I have a question from a don't know if that's a student or not, but someone who wishes to remain anonymous. And she says, "Hi, Raf. I had a PRP injection yesterday in my elbow for tennis elbow. And so far so good, way less painful than the cortisone injection. I'd asked my surgeon and the doctor who did the procedure what my rehab procedure should be and when I can start loading or exercising again, and both avoided answering the question and said to do nothing and rest it with no end date. I'm guessing this is because it's a new procedure. This will drive me crazy. I've done some research and found some rehab suggestions. If this was you, what would you do? Do you have any suggestions?" All right, so firstly, just a quick synopsis of tennis elbow and PRP injections. So tennis elbow is not something that is specific to tennis, but that's the name that people call it. Its proper name is lateral epicondylalgia, and the lateral epicondyle of the humerus, the outside kind of semi-spherical bulge of the humerus, so basically the outside of your elbow, is the lateral epicondyle, and on it is what's something called the common extensor tendon. And so all of the muscles on the back of your forearm are the muscles that extend both your wrist and also your fingers. So anytime you do a move that extends, some combination of your wrist and or your fingers, you activate those muscles on the back of your forearm, and all of those muscles share a common tendon which inserts into the lateral epicondyle of the humerus. So lateral epicondylalgia, algia just means like pain. So lateral epicondylalgia just means you've got a pain on the outside of the elbow in the region of that tendon. And the pain is sometimes thought to be associated with a tendinitis or tendinosis or tendinopathy of that common extensor tendon. And so one of the treatments actually that's quite recent and is showing some promise in the research is platelet-rich plasma injections, in which they basically draw some of your own blood, and then they separate out the blood, and they take actually the red blood cells out of the blood, and they leave in the platelets, which are basically the clotting factor in your blood that causes it to clot and triggers a whole bunch of other sort of healing responses, in a cascade within the blood system. So the plasma is just basically the water that makes up most of your blood volume, with a bunch of mostly proteins, molecules floating into them, mostly proteins, and a lot of those have to do with immunity and healing and stuff. So basically they inject some of your own blood minus the blood cells back into the tendon, and that is a PRP injection, and there's some quite promising research that shows that can be effective in this condition. So, this person has pulled up a couple of studies, and one of them was a systematic review called Post-Procedure Protocols Following Platelet-Rich Plasma Injections for Tendinopathy, a systematic review from 2020. And the synthesis says, although the clinical effectiveness of PRP remains controversial, even less is known about the effect of post-PRP protocols, which may affect the outcomes attributed to PRP itself. No studies directly compare post-PRP protocols, and the protocol studied demonstrates substantial heterogeneity. Some consensus writing regarding post-PRP protocols exist, although the rationale for these recommendations is limited. Basically what that says is they don't really know. But if we read a little bit deeper, it says the majority of protocols instituted a period of stretching and strengthening. Stretching programs generally began 2 to 7 days following injection, and strengthening programs began within 2 to 3 weeks. Return to play or full activity was reported most commonly in 4 to 6 weeks following injection. So that kind of gives us some rough timelines. And then there was a second document that this person has provided, which is awesome. And I didn't really have to do any research on this one because it had already been done for me. And this was a UW, I'm not sure what UW is, University of Wisconsin Sports Medicine there, platelet-rich plasma rehabilitation guidelines. And this basically has guidelines that suggests that there are three phases, and the first phase is the first few days after the injection, where you basically rest it and do gentle active range of motion, pain-free, so within pain-free range. Then the next phase 2 is like 3 days to 2 weeks post-injection, and that is working, continue to work active range of motion, so basically just, moving the joint, and then adding, gentle weight bearing as tolerated. So, maybe a 1 kilo dumbbell or a little light flex band or something like that to load those muscles. And then after 2 weeks, basically, stretching exercises, joint mobilizations as needed, strengthening with emphasis on isometric and concentric activities, and then eccentric progression as symptoms allow, TheraBand drills, dumbbell exercises, balance and proprioception activities, so full range of motion. And then the final phase, it's a 4-phase scenario, 4-phase program, which is basically back, normal strengthening, stretching, etc., increase load, decrease reps, increase speed. And that is 6 to 8 weeks after the procedure. So, both of these things are basically based on expert opinion, which is not terribly reliable, but in the absence of any other evidence, as that 2020 systematic review says, there is none. I would go with that because they're basically in line with other protocols that I've seen for tendinopathy. And so, I think to the nameless person who submitted this question, I think you've already answered your own question, and it looks like you've done your homework really well. So I would just follow those protocols. Hope that helps.